Hello friends, let us now learn some bacterial diseases. Let us now learn some bacterial diseases which can cause liver, which can infect the liver and cause lesions in the liver. Okay, so first and foremost, how does a bacterial disease reach the liver? This is one question, right? How does a bacterial disease reach the liver? So if you see, this is the liver present in right hypochondriac region below the diaphragm, and the liver has two, right hepatic duct, left hepatic duct. Actually, liver produces bile which reaches the gallbladder through the hepatic ducts, and in the gallbladder the bile is stored. Okay, and from there the cystic duct, through the cystic duct, this is cystic duct, this is common hepatic duct. Both the cystic duct and common hepatic duct will combine together to form common bile duct. These are hepatic ducts. This is right hepatic duct, this is left hepatic duct. Then we have one common hepatic duct. Then this common hepatic duct will combine with a cystic duct. So this is a cystic duct. Common hepatic duct will combine with cystic duct to form common bile duct. This common bile duct will now combine with a pancreatic duct. Okay, we have pancreas, they have main pancreatic duct, and through annulus, so this is pancreatic duct. Okay, and these both bile duct, common bile duct and pancreatic duct will combine together and they open into the duodenum. Okay, second part of duodenum actually. This is one way. Next we also have arterial system. That is, along with this, we also have in the liver, we also have hepatic artery. Okay, actually, we have a hepatic artery. Okay, this hepatic artery will divide into right and left hepatic artery, and it supplies the liver. This hepatic artery originates from celiac artery as a branch. Okay, that is one thing. Next, along with this, we also have a portal system to the liver. To the liver, even the portal vein drains into the liver. So we have a portal vein which divides into three parts: right, middle, and left portal vein. This portal vein is formed by superior mesenteric vein, and we have splenic vein combined together to form portal vein. This portal vein divides into right portal vein, left portal vein, and we have middle portal vein. So actually these are the different types of, if you see, these are actually the different types of systems like biliary system, arterial system, venular system. These are different routes where the through which the infection can enter the liver. So if you see the routes through which infection can enter the liver, one, direct extension from the biliary tree. That is, in the gallbladder, if the patient develops either cholecystitis, or in the biliary tree, if the patient develops suppurative, that is infective cholangitis. So if there is either infection of the gallbladder, that is cholecystitis, or if there is infection of the biliary tree, that is suppurative cholangitis, in both these conditions, the infection which is present, this infection can enter the liver. So this infection will enter the liver in both these conditions. Second, if the patient has either appendicitis, if the patient has appendicitis, or if the patient has any diverticulitis. Okay, if the patient has appendicitis or diverticulitis, both these are mainly drained by superior mesenteric vein. So through the superior mesenteric vein, the infection can enter into the portal vein. From there, through left, right and middle portal veins, it enters the liver. So this is through the portal system. Okay, next, if the patient has either osteomyelitis, that is the infection of a bone, or if the patient has subacute bacterial endocarditis. If the patient has osteomyelitis or subacute bacterial endocarditis. Here, if the patient has either of these, now the infection will pass from the arteries, that is hepatic artery, to the liver through the arterial system. And the last and final type, it can be due to some trauma. Whenever a trauma occurs from outside, then the infection can enter the liver. So one, through the biliary tree. So if you see the routes of infection, the first route is through biliary tree, where infection of the gallbladder, that is cholecystitis, or infection of the biliary tree, that is suppurative cholangitis, enters the liver through the biliary system, that is common bile duct, common hepatic duct, and we have this right and left hepatic duct from there to the liver. Second, infection can enter the liver through the portal venous system. So if you see in the portal venous system, whenever the patient has diverticulitis and appendicitis, these are actually the infections of the small bowel. Diverticulitis is infection of large bowel. So both these will drain into superior mesenteric vein. From there through the portal vein and then to the right and left hepatic vein, the infection can enter the liver. Third, the infection might enter the liver through the arterial system, that is through the hepatic artery. That is when the patient suffers from osteomyelitis or subacute bacterial endocarditis. Now the infection through the arterial system, it can enter the liver. The last type is through the trauma. Okay, so these are the different routes for bacterial diseases to enter the liver. Now, so if you see, these are actually, so what happens if a bacteria enters the liver? Right? Why are we discussing it? Because this will cause infection in the liver and it will result in hepatic abscesses. So the topic for today is hepatic abscesses. Now, among these hepatic abscesses, almost in 50% of the cases, you cannot find any cause. So no cause is seen in almost 50% of cases. Whereas in 50% of cases, you will see the cause. A particular cause is identified in 50% of cases only. Among these 50% of cases, again, only in anaerobic infections account for 50%. So among those 50% of cases, 50% accounts to be anaerobic and the rest 50 is aerobic infections. Right. Now, in hepatic abscess, what is the symptoms or what are the clinical features of hepatic abscess? The patient presents with fever. The patient can have malaise or anorexia, that is unable to eat, unable to do things, weakness. There will be upper quadrant, right upper quadrant pain can be noticed, and the patient can also have jaundice in almost 25% of cases. Jaundice is also noted in 25% of cases. Okay, now, so these are the clinical features.